Before working with Dr. Tom's LDPC practitioner training program, I was working with chronically ill patients, mostly seeing them for chronic GI conditions, chronic fatigue, using functional labs to diagnose those conditions and then treating them with various protocols related to herbs and nutrient imbalances and overgrowth in the gut, as well as other environmental exposures that they may have experienced. I said yes to Dr. Tom's LDPC training program because not only is he renowned in his field and has a lot of clinical experience, I was also looking for a really structured program that could give me real life protocols to follow for my patients so that I could have that guidance. And also it was nice to have some of that one-on-one and group support with patient cases and to be able to bring that back to the group as a collective whole to really kind of get that guidance. If there's anything about Dr. Tom's training program that might have prevented me from getting started, it would have been the time commitment piece. As a mom, a professional trying to advance my career, spending a lot of hours seeing patients as well as some of the other commitments, that was the biggest concern for me. What surprised me the most about Dr. Tom's LDPC training program was probably the community that it created with having a bunch of different practitioners from a bunch of different backgrounds and fields and coming together to support each other, and also a lot of the featured speakers that Dr. Tom brought in. I felt supported by not only Dr. Tom, but also the group. Anytime we had patient cases that we wanted to present, he was really very open in hearing them and kind of helping to run through the differentials and run through the case study itself. So that was really nice to kind of have that level of support by the owner of the practitioner training program. That's not always the case. Going through the training program helped me feel a lot more comfortable treating my chronic illness patients, especially those with tick-borne disease and Lyme disease. That was really what I was looking for from this program, was some direction, some critical thinking skills. What sets Dr. Tom's LDPC practitioner training program apart from other training programs, and I've done a lot of them, I think is the structured nature of it and some of the real world utility, some of the real world information about specific cases, how to handle those cases, a lot of the didactic, that sort of happens regularly in practitioner training programs. But being able to have one-on-one mentorship and group mentorship, as well as being able to talk about cases, I think is, probably the most valuable piece of this particular training program. If you're on the fence about attending Dr. Tom's training program, I would tell you this. If you want to advance your career in functional medicine or managing chronic illness, this is a must. Being able to identify Lyme, tick-borne disease, advanced chronic illness, this is a part of that process. And I will say that you'll continue to get stuck and continue to have to refer your patients to other people until you've done a program like this where you can navigate those symptoms and have a better algorithm about figuring out what the next steps are and feeling confident about what labs to order, how to interpret them, and then how to treat that person for that condition. This is your next step. TRACEY, Sacramento, California.